For here, we have a bit more complex system. For the muscarinic receptors, they are G protein coupled receptors. Now let's start with the inhibitory one, the GI. Now the inhibitory one is mainly M2. M2 is the main inhibitory one. The others too, but M2 is the main one. Now we'll be taking a look at your AV nodal cell. In this case, acetylcholine comes bind to the receptor, and then GDP, which is normally bind to the GI, leaves and allows GTP to bind to it, activating the GO protein. The G protein goes and inhibits adenine cyclase. Normally, adenine cyclase will convert ATP to cyclic AMP, which will then activate protein kinase A and then phosphorylate proteins, for example, receptors to allow ions to come in. But this can no longer happen because GI has inhibited adenine cyclase. Now, GI does something else too. This GI, it has a beta and gamma subunits. The beta and gamma subunits binds to the potassium ion channels and allows for efflux of potassium, making the cell hyperpolarized. And as such, your heart doesn't contract as much as possible. So you not have, at the end of the day, having bradycardia. Now, for the stimulatory part, we'll be looking at the GQ protein. Now, we're mainly looking at M3, but there is also M1 and M5 also, but mainly looking at M3. Now, again, acetylcholine comes to bind to the receptor. Once it binds, GDP leaves the protein, and GTP comes to bind to it and activates the protein. And this GQ protein comes here and activates phospholipase C in the cell membrane. Phospholipase C then comes here and sees PIP2 and like, okay, I'm going to break you down into DAG, diacylglycerol, and IP3. Now, IP3 goes to the sarcoplasmic reticulum and releases calcium. It does calcium in the cell, which leads to contraction. Then, DAG comes and activates phosphokinase C, which will go and phosphorylate proteins, especially receptors, to allow ions to move in. As a result, there's a lot of positive ions inside the cell, which will lead to contraction. And you have increased motility of your GIT.